Okay. Tonight we are going to do an abdominal assessment. First, I will do a room scan. Okay, and that's the chair that I'm going to put my computer. That's where I'm going to put my computer. Okay. Okay, so good evening, Mr. Montagna. Tonight we are going to do an abdominal assessment, and I'm going to ask you a few questions. Did you experience any abdominal pain lately?
No.
And how about nausea and vomiting related to abdominal issues?
No.
Okay, and did you have any abdominal surgeries in the past?
No.
Okay, so first I will do inspection of your stomach, okay? And first I'm checking the symmetry, it's equal, and it's round, and okay, so it's round, and the umbilicus is inverted, and I can see the skin color. I'm checking for pigmentations. I can see a little bit of pigmentation on the left upper quadrant. No pigmented nevi, no scars, no scars, no lesions. Just a little bit of hypopigmentation here and not here. So it's rounded, and I'm now checking for the pulsations and movement. There is respiration, movement of respiration. It's regular, and the aortic pulsations are noted here, but there are no obvious waves of peristalsis. So now I will auscultate using my stethoscope. I will auscultate using the diaphragm of my stethoscope. I will auscultate the four quadrants of your stomach, Mr. Montagna, and I will note here the characteristic and frequency of the bowel sounds. So I heard gurgling sounds on the right upper quadrant. I'm going to proceed to the left upper quadrant. There I can see the gurgling sounds. So I can proceed. I can hear the gurgling sounds. And the right lower quadrant. There I can hear the gurgling sounds of your right lower quadrant. Using the bell of my stethoscope, I will check the vascular sounds. Okay, so first I will check the aortic um, arteries, just 2 inches above the umbilicus. Okay, I heard pulses, and then beside that are the renal arteries. Okay, and below the umbilicus is the iliac arteries. I'm gonna go side by side, just 1 inch below the umbilicus. That's the iliac arteries, and I should hear pulses. Okay, and then now I will do some light palpation. Just I'll press about 1 centimeters in your abdomen, okay, and tell me, yeah, because if there is any tenderness or pain. Using the about 2 or 3 fingers, using the um my fingers, the soles of my fingers. I'm checking all or palpating all areas of his stomach, all quadrants, all areas, checking for any tenderness, if I see any lumps here, masses. Is there any pain here? And if there is
No.
any pain, I will save that area as my last area to palpate. And so there is no tenderness, soft and tender. And then now I'll do deep palpation. So I will be pressing a little harder, okay? About 5 to 8 centimeters. And now with deep palpation, that is checking for any enlargement of any organs, okay? Is that painful?
No. It's not painful.
Okay, I'm also checking for any lumps, masses. And mostly deep palpation is checking for the enlargement of any organ. So no tenderness, and his abdomen is soft and non-tender. So that ends the abdominal assessment video. Thank you.